Guys, this is Jennifer Smith, Program Director over at the Encompassing Center. We're a mental health center located on the west side of Chicago at 3019 West Harrison Street in Chicago. Yay to the west side, yay to mental health. I come to you guys today for some informational purposes. And guess what? It is May. And guess what May is? May is Mental Health Awareness Month. And so for the month of May, we are coming with our green. I got my green shirt. I got my green nails because I'm here to celebrate with you guys. And we're going to be coming to you each Friday at 3 o'clock. Please check out our Zoom links and please check out our videos. We are coming to you with some information about mental health. We're celebrating the topics. We're allowing you guys to jump in and talk to us to kind of see where your thoughts are, where your minds are at, what you've been doing in the community, getting information you need for mental health, and just celebrate May in mental health. So I'm coming to you today as the first Friday, kicking off in my green. And we're going to be talking about stigma today, mental health and stigma. And so when you think of stigma, what do you think of? You think of things that aren't really true, things that cause barriers, things that are just not accurate when it comes to statistics or just ideas and thoughts or just information about mental health and mental illness. And so that is why I'm coming to you today to kick off May in our mental health series, which it's okay to be bad. That's the theme. It's okay to have bad days. And we always have times that are great, but then there's times that's not so great. And that's okay. And so that's the theme for this month, that it is okay. And that we are here to help and we are here to educate and just have a good time, just having these open conversations. And so today I want to bring you a couple of myths that are very common so we can debunk those and set the great foundation you guys need as we have discussions each Friday where we're talking about mental health in children, we're talking about mental health in women, mental health with men, and those that are suffering from substance use disorders. So please stay tuned and stay with us, stick with us all month of May as we talk about these topics. But I'm going to do the drum roll. And our first myth is that people think that mental health is not common, or people say, oh yeah, mental health is not a common thing. That's very rare. You don't see a lot of people with mental health issues. And that, my friend, is a myth. And so what does the statistics say? It says that mental health problems are very common and that 1 in every 5 people will experience some mental health issues in any given year or any part of their lifespan, and that 1 out of every 25 can have a very serious mental health disorder. And that can include anxiety, depression, things like bipolar, schizophrenia, all that stuff. And so we want to make sure that you guys know that mental health concerns and mental health issues and mental health disorders are very common. We are all human and we go through things. I know we've just experienced all together this thing called COVID-19, and we were resilient. We were able to survive that, but there's a lot of aftermath of that as well. We've had loss, we've had anxiety, we've had uncertainty. So we are here to know that you are not alone in your struggles with mental health, and that we all, if you went in a room with 5 people, at least one person would be struggling from something related to mental health. And so that is our debunked myth number 1. And so number 2, another myth, stigma, is that kids and teens, and sometimes even infants and small children like toddlers, do not have mental health problems. Oh, they're just doing too much, or they have an attitude, or they're just ungrateful. Those are the really tough things that we label our teens and our kiddos with, and it's not necessarily true. And that research shows that 1 in 5 teenagers will or have a mental health issue. And 50% of those adults that we said, remember, we said 1 in 5, those adults have a mental health issue, showed their first signs around age 14. Yeah, that's crazy, right? It's like, what is going on? And so, yes, our kids, our teens, even our babies, they may not be able to have the language to share and say what they're going through and how they feel. But guess what? If a baby cries and their needs aren't met, those are some signs that they're internalizing and saying that, the world is not safe, and that can cause anxiety later. And so we want to make sure that we are taking care of our infants and toddlers, we're taking care of our kids, and we're taking care of our teens when it comes to mental health. So that is a myth, my friends. Teenagers, kids, and infants can suffer from mental health issues. And so that leads me to my third myth. Third stigma is that people with mental health issues are violent or aggressive or dangerous. And so the research says the fact is that a large majority of mental illnesses and people with mental health issues are not violent. And so the only percentage is about 7 for people that are actually violent or commit violence acts and they have mental health issues. And so, yes, people with serious mental health issues are 10 times more likely to be a victim of violence. And so, yeah, I know there's probably a lot of conversation about, those that are incarcerated, or we hear things on the internet about massive school shootings or things where, the first thing people jump is like, yeah, they have a mental health issue, a mental health problem. And so that may coincide with certain people that we see in the media or things like that, but that's not your average individual. Your average person suffering from either anxiety, depression, bipolar, they're not violent. They may have some irritability or some mood swings, but that could be a part of their condition or disorder. But it doesn't mean they consciously go out to be violent. So that, my friends, is a myth and stigma we want to debunk. We do not want to be fearful of someone. We want to be able to help. And I'll give you guys a couple of things we can do later at the end of this video to help those in need for mental health issues. And so another myth and stigma is mental health problems are for the weak at heart. You're weak, or you are not strong if you have a mental health concern, issue, or disorder. And that is not true. That is not. Sometimes there's things that are in our genetic predisposition. There's some chemical imbalances. There's some things, life stressors, life events, whether it's someone passing away and there's prolonged grief and loss. That doesn't mean you're weak. That means that you're human. And so we don't want to label someone as weak, because they're suffering from something that there is no control over. We lose people, right? We deal with things out of our control, like COVID, or our crazy city with the weather. We don't know if we have to wear a jacket today or tomorrow, or if it's going to be sunny like today. We just don't have that kind of control. And so sometimes that can lead to feeling helplessness or hopelessness and some depressive symptoms and things like that. But that, my friend, does not mean that you are weak. You are strong, and you know that, and you have to believe that in your heart. And so I'm going to move on to our next myth and stigma, and that is when someone develops a mental health problem, it's with them for life, and they will never get better, and there's no hope. What's the point? And that is a myth. Just because you have something that you're dealing with does not always mean that it's going to be forever. Life and mental health conditions can go up and down all the time. There could be a job that you're trying to get and your anxiety goes up through the roof. It's at an all-time high. That may be a one-time incident, or like I said, grief and loss, where you've lost someone and therefore you can't get out of the bed and things like that. And yes, time heals wounds, but it doesn't lessen the fact that you are hurting or that your loved one is gone. And so we have to make sure that we understand that mental health doesn't stay the same. Sometimes people are very adamant in doing the things they need to do to alleviate some of the symptoms that are, at an all-time high. That may include things like psychotropic medication. If you're taking medication, you're taking consistently and it's working, yes, you may see some of those symptoms reduce and you are slowly recovering and things like that. And that means you may have to continue a regimen. I know sometimes people don't feel like, kind of like antibiotics. They tell you take it for 7 days, right? But as soon as we take it and we feel better by day 3, we want to stop. And no, that's not how that works. And sometimes we have to remember that our brain is an organ just like everything else. So if the doctor tells you like, hey, you need to take you need to take insulin for your diabetes, or you need to take this cholesterol medication to bring that down, or high blood pressure, we're quick to go ahead and follow our doctors, because we don't want to have a stroke or a heart attack or, complications that come with severe diabetes. But why is it that when we come to our brains and there's medication that needs to help that, we shy away? We don't want to take it. And that's because of stigma. And it's no different. Like, your organ is no different from your heart, from your skin, if you go to the dermatologist, from any other specialist that you go to see. And so please take that in consideration when you're thinking about your mental health. Like, your brain is such a precious organ, and we want to make sure you guys are taking care of that. And so that leads me to the next myth. And that's the myth that therapy is a waste of time. Sometimes people talk about access and that we don't have the availability of mental health services in our community. But one great thing about like the Encompassing Center is that it is located in the heart of the West Side, and it is no cost to those in North Lawndale, East and West Garfield Park in your West Side. So there is a resource in your community that is available to you, regardless of your ability to pay or insurance, economic status, gender, sexual identity, you name it, age. We see everyone across the lifespan to make sure we take care of your mental health. And so that some people may feel uncomfortable because this is new, right? You're talking to a complete stranger. And who wants to do that? Especially if you're introverted or you're shy. You don't want to disclose all those things to people. But then sometimes they feel like they're a burden when they keep talking to their friends over and over and over, and they're like, they are tired of hearing the same story. No, a therapist is there. Their job is to be able to listen, to hold that for you, so you don't have to hold the burden yourself or hold it alone. And so the research says that studies found that 70 to 90% of people reported an improvement in their symptoms when they were a part of a treatment plan in therapy. And a treatment plan is that set of goals that you're going to work on to improve, whether it's coping skills, reducing your anger outbursts, or reducing the amount of substances used, whatever it is. Your therapist can work with you on that. And it doesn't matter, big or small. Everyone could benefit from having that extra listening ear. And so therapy is not a waste of time. Please, if you have questions, call us and we're able to answer anything that you have. And so that leads me to my next myth, which is really one thing I emphasize, and that is when people are feeling like they can't help someone with mental health issues. You don't have to be a therapist or a counselor or a psychologist to help someone with their mental health. And so here are some things that you can do. And remember, I said I want to give you guys some things that you can do that will be beneficial for those that are suffering from mental health issues, disorders, concerns. And that's one, let them know that you are there if they need you. You don't have to spend money. You don't have to make extra time. But if someone says, hey, I need you to help me call. Hey, I need you to come with me just to drop me off. Or hey, Can you answer your phone when I'm done with my session? Because this is scary. Can I talk to you? Let them know that you're there in any capacity that you can be. And that's where you set your own limits and boundaries, because sometimes it can be very difficult to care for loved ones and friends and family that are suffering from mental health disorders. And so, in order to care for yourself, make sure you set those healthy and appropriate boundaries. You may say, hey, I'll drop you off. Great. And you know what? Make sure you call your sister when you get done, because if you're not able to hold that space for them, maybe someone else can, and you can pass that torch, and that's okay. And so the next thing you can do is help them find the mental health services they need. I know we stay on Facebook, we stay on Instagram and TikTok, we watch the news, we're in our neighborhoods and our communities, and sometimes we know resources that we may not feel we need to utilize, but we can help someone else access that. So someone may say, hey, you need to see a therapist. Hey, I know that the Encompassing Center is on that corner, across the street from that school. You should walk in there and check them out. Or, hey, I know this organization does this. And hey, I know I saw an ad about that. You should do that. There's other resources too, like BetterHealth, and you can find a therapist on Psychology Today. You can call your primary care physician. You can do a lot of things, but it can be scary. So just make sure that you can be there for someone and help them and pass those resources along. It's kind of like I say it's like a coupon, you get those coupons in the mail and you really don't need it, but then that day comes and you're like, oh man, I could really use that 20% off. And then it's there. So that's the same concept. So you guys can do that as well. Again, another tip, learn about what they're going through. Sometimes people are very knowledgeable about their diagnosis and disorder, and they can educate you, but you got to be open to listening and being receptive and doing it with a non-judgmental mindset, because there's nothing like telling someone your story and they're like, oh, but that's nothing, I did this, I did that. And it's not about you, but it's about the person, and you willing to open up your ears and heart to that person and be willing to learn. Because one thing about mental health, just because it looks like something with one person, it's going to look different from someone else. And sometimes the very same diagnosis could look differently between an adult and a child. And so one thing that stands out for me is like depression, where someone could be very sad in the bed and not moving, where the teenager or the child is like aggressive and moody and throwing things and upset, where they look angry, but they're depressed. And then you have those that are very functional that you may not even know depressed, and they can go to work and they can move and do those things, but they're hurting inside. And I know we've all seen that just in recent news with different articles that have been out, and just news notices about people that have committed suicide, and they look perfectly fine. They're dancing on TikTok. They have the world at their feet, and they've taken their lives because of their mental health disorder or condition or illness. So know that it can look different. So be open and receptive. Again, a next piece, treat them with respect. And that's part of that listening. And also just, being there to say, hey, can I ask these questions? I want to be respectful. Is it okay that I say this or share this with you? And so we want to make sure you guys are being respectful to those across from you suffering, and that you don't use the word crazy. That is the biggest stigma that I think we all suffer with. It's like, oh, you got bipolar, you crazy. Or we use it in a joking manner, like, oh, the weather in Chicago is acting bipolar. And it's like, ooh, that's very insensitive and disrespectful for someone that is suffering from bipolar disorder. And it's not accurate information. And so We want to make sure we're being sensitive to the words that come out of our mouth when we're talking to others. And so again, express your support in ways they can understand. Again, back to those boundaries and knowing what you can give. Do that as well when you're giving help and expressing your support. And then also get help for yourself and don't give up on them. Sometimes it's really hard. We've all had those family members that have severe chronic mental health issues, and we just don't know what else to do. We want to throw in the towel. We can't find places. They may be severely ill to the point they need residential. They may need critical care. They may need hospitalizations, and it can be really tough. So that's the time where you can take yourself to a therapist and get services for yourself where you may feel like, well, I don't have a mental health diagnosis. I'm just stressed out. And guess what? That's part of the mental health concerns too. There's a book, big old book, we call it our therapist Bible, where there's DSM codes and symptoms in there. So it's very similar to like when you go to the doctor and they say, hey, what are your symptoms? You may say, okay, I'm nauseous, I've been throwing up, I've got headaches. Yeah, we want to continue to explore that because guess what? Those same symptoms can either look like the flu or pregnancy. Which one? Because guess what? We're going to treat the flu very differently than we're going to treat pregnancy. So that's where the professionals come in, figure it out which one it is by talking you through it and providing the right interventions for that. And it could be something as simple as adjustment disorder, where you're trying to adjust to being the caregiver for someone or taking that role of support. And you want to be able to take care of yourself because guess what? We need you just as much as we need the person that is suffering. And so we want to make sure you guys are taking care of yourself. And so that brings me to another myth, which is, oh, you can't prevent getting a mental health illness or disorder. And the fact is that you can't always prevent getting mental health problems, but you can address the risk factors and that you or your loved one may be exposed to. And so what is that? What is being exposed? There are things that we all collectively, that is like vicarious trauma that we all encounter. So watching someone get harmed in the news, we all are impacted by that in some way. But then there's those individual things that each person is subjected to that can make illness become more severe or presents itself where it may be dominant if they weren't exposed to certain things. And so we want to try to minimize exposure to any trauma. So, if there's a family, where mom and dad and there's disagreements and argument, we want to make sure we are having those conversations and things outside of the presence of children, because guess what? Those kids are internalizing it and they're watching those relational behaviors, and therefore they may grow up and perpetrate and engage in domestic violence or become a victim of domestic violence because they're watching, the adults in their life behave in such way. Staying away from different type of media. We want to watch what we internalize. So like the violent video games or movies and things like that, we want to not expose ourselves to those things that can be very triggering and very influential, especially with children as well. We want to make sure we're reducing stress. Having stressful jobs, careers, home life, all those things can increase the symptoms that you have. And that you want to make sure that you are doing the things you can do to reduce those stress. And then putting yourself in positive situations. So hanging with those friends that are very encouraging, not the toxic friends that want to, they want to, all the time you guys are together, it's just bashing and complaining. That's not good for our mental health. We want to be able to engage in exercise. We want to make sure we get outside when Chicago's nice and it's sunny and get that vitamin D. And we want to drink our water and mind our business, as they say, or do all those things. We want to establish healthy habits. That means something simple as making sure you're eating breakfast, lunch, and dinner and snacks. It could be simple as going to bed on time. It could be all those little things that you can do to kind of help improve your mental health and improve functioning and be able to be there for others. And so the biggest thing about stigma is that it prevents people from getting the help and support that they need. And so we want to make sure that we are doing the best we can to care for self, and then doing what we can to help those in others, being non-judgmental, being compassionate, listening, all the things that I've shared so far in this discussion. Because guess what? We know that it's 1 in 5. We know that people will develop something over the lifespan in their lives that they have no control over. And there's a myth that if you try, or if you pray, or if you do all these things, it'll just go away. And remember, we talked about it being an organ. Sometimes those things aren't just easily going to disappear. And so we want to make sure that we are doing the things that we can to either eliminate it or reduce the symptoms or take care of ourselves if we are suffering. And so again, loneliness and isolation, mental and physical trauma as a child, chemical imbalances, genetic disposition, neurological issues such as traumatic brain injuries. That's one thing we do as clinicians. We want to assess the physical stuff too, because sometimes mental health symptoms can show if there's something physically wrong. So I am a huge advocate of making sure people get blood work done, people make sure they talk to their doctors, make sure we assess from a trauma-focused lens. Has there been any head injuries, any other issues that could be impacting someone's mental health? And then also drug and alcohol use. We want to make sure we're staying free of substances, because that can also alter our brains and our minds and things like that. And those symptoms can look very similar to another mental health diagnosis. So if someone's a chronic drug user and they are hallucinating, that can look very much like schizophrenia. But if the person is not taking substances, those symptoms kind of go away. So we want to make sure we're asking about the things people are using and getting them the help they need. And then sometimes physical and serious physical health conditions can hinder and impact someone's mental health. So making sure there's things in their hormone, making sure there's nothing in their hormones, checking thyroids, making sure blood work is done, making sure there isn't other things like brain cancer, tumors, things that are impacting us physically. We could start hallucinating if we're not getting enough sleep. And if we're having insomnia, what is it from? Is it from weird work schedules? Is it from anxiety? Is it from, sitting up all night for whatever reason? Limiting TV time and social media and the screens and things like that. So we want to look at it in a holistic manner. We just don't go out just giving people labels. Like, that's not what we do. We want to make sure people are getting adequate care and they're doing this from a holistic lens. And so if there's any other myths and ideas that you guys think of, feel free to reach out. You guys can call us anytime and we're able to answer questions. I know some of the other last minute things that I think of with myth and stigma is medication. And some people feel like, oh, I don't want to go because I don't want to be placed on medication. And while some disorders, illnesses require medication to help with symptoms, you don't always have to be medicated. That's always a very last resort. And if you've had to take medication in the past and you feel better, guess what? Sometimes it's one of those things where you may have to continue to take it to feel better. Kind of what I talked about earlier. If it was insulin, as much as we want our bodies to make it, we can't. And so as much as we want our minds to be balanced, we sometimes can't do it on our own. And so that's where medications come in play. And we want to see medications as a tool and not a hindrance or a disability. And that's where a lot of that stigma comes from. We want to make sure that two people are not the same. So what someone is taking may not be what you're taking. And I know we're so used to doing that, like, child, I took that and it gave me a headache. And I can't take that. But it's like everybody's bodies is different. And so we want to make sure we do an assessment for ourselves. And so medication can be a great tool for recovery. And then also the last stigma that I want to kind of go over before I wrap this up is that, again, making sure that we know that people can still live life. One of the biggest things is that once you get a mental health diagnosis or illness, you can't work a job, you can't live life to the fullest, and that is absolutely not true. And the idea that someone with mental health issues can't work is a myth. Someone that has mental health issues can't parent, that's a myth. Like, there's people who care for their kids all the time with a mental health disorder. So that is not entirely true too. Again, they will never get better and recover. That is not true. Some people can get better over time, and it's waves of ups and downs. And then again, remember, they're not violent. They're not those people that we see all the time on the news. Sometimes people just do evil things, and sometimes people do impulsive things. Sometimes people do things for survival, and it doesn't always mean that it's related to mental health. So we have to be very careful how we label people and things that occur in our world, so we can better reduce the stigma and better educate people on mental health issues and disorders. And so with that, I want to wrap up our discussion today with the myths and the facts and things like that. And so what I would love to do is challenge you guys to go ahead and to talk to someone and have a discussion about mental health. What are their thoughts? What are their thoughts? What are their ideas? How do they even present when you bring up mental health? Is it like what are you talking about? Or is it like, oh yes, let me tell you. So I want you guys to do that. Just start having these conversations this month in May. And I want to challenge you to kind of think about your own mental health, think about where you can improve. You may not have an active diagnosis where you're seeing a therapist or a medical professional, but I'm pretty sure there's things that have you feeling low or feeling stressed or feeling anxious. And there's so many wellness things you can do, from swimming to yoga to meditation to prayer to good sleep hygiene. Like, there's nothing like a good night's rest and a good meal before bed. So make sure you guys are doing those things. We're going to have our next topic on Friday, and that will be at 3:00 again. We will be talking about mental health in children and teens. Again, we'll be talking about mental health in women and mental health with men, and also people with substance use issues. And so we want to make sure we are tapping into this, learning the right language to use, knowing what we're looking at. There's so many trainings out there. One of the big ones is mental health first aid. It's similar to like learning CPR, but how to be there for someone who's suffering from a mental health disorder or crisis. So you guys are amazing. You guys are doing the work. If you're listening to this is the first step in educating and just getting comfortable with talking about mental health. And so I challenge you to do that. I hope to see you guys throughout the May. Make sure you wear your green throughout this month, especially on Fridays, and come join us. Like, the Zoom is open for everyone, and you can bring your questions, your comments, your discussions, and all that good stuff. And so I challenge you. I thank you. We love you guys, and take care. Enjoy this Friday. Enjoy this lovely day we have today. And remember, mental health is not scary. It is not a curse. It is something that we take serious and that we take action, and that it is okay. And that's the theme we continue with this month of May. So thanks. Bye.